Funds set aside for social services and for the healthcare sector were a huge part of the budget debates on Thursday. Thursday's budget debates started off with opposition parliamentarian Natasha Singh Lewis speaking about the social services sector and sharing her view that not enough is being done to support people most in need. Soon following her was the Minister of Human Services and Social Security, Dr. Vinya Prasad, who spoke extensively about all the work her ministry is doing to empower and support vulnerable groups in Guyana. And she strongly defended the allocations made to her ministry this year.
Much of the budget revolves around senior citizens, and I'm happy that the honourable member before me spoke at length about the 1800-year-old Palms, the Palms facility that was in the 1800s. And I would like to say that this government has allotted $172 million for a spanking new senior citizens home because we are concerned about the senior citizens across this country. Mr. Speaker, it is important that the people of this country understand what the budget has to offer. And it is not only a senior citizens home that we are doing for those who fall into that category. There are many other things. The senior citizens home will be based in Enmore, and it is our vision that eventually those persons will move to that home, and the Palms will be something to look back at as where it all started, because it has absorbed so much in the rehabilitation and repairs to it.
Following those presentations were presentations by opposition parliamentarian Dr. Karen Cummings and the Minister of Health, Dr. Frank Anthony. Now, those two parliamentarians clashed on what is being done in the health sector. Particularly, they both zeroed in on Guyana's shortages of healthcare personnel, particularly nurses.
Several nurses who moved to the United Kingdom this year have indicated that the current salaries are double and triple the amount they were paid while working here in Guyana. In addition, the relocation packages offered by foreign hiring firms also cater for the well-being of the nurses' families. The call by this government to address this shortage of nurses by bringing foreigners nurses is unacceptable. The expansion of postgraduate training at GPHC, developing a hybrid nursing program to increase the training of nurses from about 150 to 200 per year to enable the training of 1,000 to 1,500 nurses alone will not cut it.
Migration of nurses is a global phenomenon. It's not only confined to Guyana. But what is important is what we do. And the capacity to train nurses in this country with the 3 nursing schools was about 200 nurses per year. Last year, we started a program where we have 1,200 persons who are right now doing nursing. This year, we are taking in another 1,200. Next year, we'll take in another 1,200. The year after that, we'll take in another 1,200. And we will employ every single one of them. Next month, Mr. Speaker, we will also be taking in 1,000 people to do the nursing assistant program. And next year, we'll take some more. And the year after that, we'll take some more. And while we take in those persons, and let me explain the payment to you. Let me explain payment to you. Under APNU AFC, from 2016 to 2020, the percentage change for a staff nurse was 35%. Under this government, from 2020 to 2023, the percentage change in their salary was 71%.
Later in the day, the debates continued with a focus on housing. The 2024 budget debates are expected to conclude on Friday, and next week there will be the consideration of the estimates.